My name is Randall Miles, and I'm reading for the part of the neurologist in the Parkinson's disease commercial. The first is case 1, early Parkinson's disease with depression and anxiety, a female patient case. The patient had reported generalized anxiety symptoms approximately 5 years before the onset of her motor symptoms, which seemed unusual as she had not had any significant psychiatric symptoms prior to this point. At the time of PD diagnosis, in addition to the anxiety symptoms, she developed a sad mood and loss of pleasure, and a sense of hopelessness about the future, connected with the diagnosis of a chronic neurodegenerative disease. Although these symptoms resolved, about 2 years later the patient had a recurrence of these depressive symptoms when she noticed that the PD symptoms were progressing, and the anxiety symptoms evolved to involve some social phobia symptoms too. When did you first notice these anxiety symptoms?
It's strange, but about 5 years prior to noticing the tremor in my hand, I started to become increasingly anxious for no clear reasons, which I had never experienced before.
And how would you describe these anxiety symptoms?
Well, just a sense of mental anguish, worry, and physical tensions. It was present a lot of the time and most days.
And did you receive any treatments at that time?
No, I thought it might go away, and then I developed my tremor.
And what happened then?
I was afraid to start treatment for PD, so I waited. And as I found myself thinking about the diagnosis, my future, its impact on my family and career, I started to become depressed.
And describe for me what you mean by depressed, please.
Well, my mood became down a lot of the time. I isolated myself more. I wasn't enjoying things as before. I thought it would get better with time, and it helped lead me to initiate Parkinson's medication.
And did that help you?
I started a dopamine agonist. It's interesting. I noticed that both my Parkinson's symptoms and mental state did improve.
And how long did that last?
Really for several years, but then my motor symptoms started to worsen and I noticed my down mood returned, this time with poor sleep and appetite, and the anxiety was getting really bad. This time I also became afraid to be in public places due to the severity of my Parkinson's symptoms.
I see. All right, that is the first case. The next one then is the male patient. Pardon me. Is the male patient case for late Parkinson's disease with cognitive impairment and psychosis. The patient first reported illusions, mistaking a lamp for a person, and passage phenomena, unidentified object moving in periphery of vision, which did not trouble him. Around the same time, he noted some mild cognitive changes, including concentrating, such as reading the paper, and finding words in casual conversation. Things remained fairly stable for a few years, other than development of REM behavior disorder symptoms, noticed by his wife when she was struck one night during sleep. Then the patient developed a urinary tract infection that led to delirium and required hospitalization. Although the delirium resolved, 1 year later the patient was noted to have significant cognitive impairments in multiple domains, with functional impairment that led to a diagnosis of dementia, full-blown visual hallucinations, and mild paranoia about his wife's infidelity, and acting out dream behavior several times per week. So what emotional symptoms did you notice first?
One day I was talking to my wife, and I thought there was another person in the room, but it turned out to be a lamp.
And did this bother you?
No, it was kind of funny at first, but over time it started to happen more frequently. Then I had this strange sensation of something moving in my side of my vision field. I couldn't identify what it was.
And did you notice any other changes around this time?
Well, a couple of things. First and most concerning was that I was having more trouble concentrating. I found I was having trouble getting through an article while I'm reading the morning newspaper. And don't forget about that overnight behavior you nearly killed me. Well, I don't remember that, so tell the doctor. One night in the middle of the night, he woke me up because he was yelling out loud and thrashing about. He accidentally hit me in the face with his arm. It was quite a shock.
That sounds like a lot of difficult symptoms, well, for the both of you.
Yes, put a lot of stress on both of us. Then things got really weird when I got a urinary tract infection later. It started out just as painful urination. Before I knew it, he was agitated and hallucinating. He had to be hospitalized. He became so confused. It took weeks for things to really improve, and he never really got back to baseline, and things have worsened again over time.
And what have you noticed?
Clearly, my cognition has worsened a lot. I'm not able to remember or learn things as well, need help doing what used to be routine activities for me, such as paying bills, preparing meals. Can't drive anymore. It's just too complicated for me. Yeah, he's really not the same person in some ways. Cognitively, he was so sharp, and now he really needs my help for some things. And the vivid dreaming behavior occurs at least several times a week now, so I sometimes sleep in a different room. And finally, not only is he seeing strange men in the house, he's convinced that I'm having an affair in our own house. It's ridiculous. Well, I know what I see, and I know what you're doing.
Thank you. Again, my name is Randall Miles. Thank you for your consideration.